Hi everyone, and welcome to today's session on AHP Preceptorship. My name is Helen Marriott and I'm a physiotherapist by background, and I also work for Health Education England in the Midlands region, where I'm the head of allied health professions. As part of my portfolio of work, I also lead nationally on AHP Preceptorship and early careers support for all of the 14 allied health professions. So delighted to welcome you to this session today. And I'm also delighted to have 4 very knowledgeable and passionate panel members joining me to talk about preceptorship to us. We're going to be looking today at understanding what is preceptorship, what is it all about. We also want to think about how preceptorship actually helps people transition from into employment, especially in their early stages of their career as they're newly registered. And we're going to explore some of the benefits of preceptorship. So hopefully there'll be some of the things that you will be much more knowledgeable about towards the end of today's session. So without further ado, I'm going to ask each of our panel members to introduce themselves and tell you a little bit about themselves before we go into some questions with the panel. Okay, Anne, could I come to you first, please?
You can. Thank you, Helen, and it's great to be here. So my name's Anne O'Brien. I am a physiotherapist by background. I've worked in the NHS for 15 years, and then I decided to do a split role as a lecturer practitioner in education and in clinical. And I've been working at Keele University for the last 20 years in different guises. I'm now head of school of the allied health professions at Keele. So we've got physiotherapy, we've got radiography, we've got prosthetics and orthotics, rehabilitation, exercise science, other programs as well. And I've also got a particular interest in preceptorship because one of my other hats that I wear is Staffordshire Stoke-on-Trent AHP faculty chair. And we've done a particular piece of work about preceptorship in the last 18 months. And we're trying to get a publication out of this, but actually it's a really interesting time, which I'll tell you more about as you want me to, Helen, but I'll tell you a bit more as and when.
Thank you, Anne. That's great, and great to have you with us today. Thank you. Felicity, could I come to you next, please?
Yes, thank you, Helen. So I am Felicity. I'm a podiatrist by background. And quite similar to Anne in the respect that I was doing clinical podiatry full time, and then I did a split post where I got the AHP preceptorship lead within my trust, and I was also doing podiatry alongside that, but I'm now full-time AHP preceptorship lead within my trust, which we run locally, regionally, and also nationally now.
Thank you, Felicity. Chantal.
Hiya, so I'm Chantal Allen, a speech and language therapist based at Russell's Hall Hospital, so part of the Dudley Group. So I specialise in treating patients that have had a stroke and helping them with their communication and swallowing disorders. But prior to that, I had a range of experience working on other wards as well. So I got to work with patients that had Parkinson's disease, and also dementia patients as well. And I'm just really excited to be a part of this discussion because especially since I started my preceptorship and my NQP year during the pandemic. So I started in May 2020. So as you can imagine, it was very challenging. But if it wasn't for the support that I had from my colleagues, I wouldn't have gotten as far as I have right now. So yeah.
Oh, Chantal, thank you very much, and some great experiences I'm sure you'll be able to share with us from some of that. So thank you. And last but not least, Amanda.
Good afternoon. My name is Amanda Weaver. I'm a physiotherapist by background. I've worked in the NHS for over 20 years, working clinically, but then working within the early careers area for the last 5 years, working at an organisational level, involving physios, OT, speech and language and dietetics in preceptorship, and then all AHP groups and seeing how important it is for development. And I'm currently working for Health Education England as the AHP Preceptorship Workforce Lead with Helen, developing and delivering on some project work to develop preceptorship from early in people's careers throughout and develop them and support them to be the best that they can be.
Thank you, Amanda. Great for you to be joining us too. So I'm going to start off the conversation now by asking all of you about what is preceptorship and what does it actually mean to you, to help us all to understand a little bit more about what we mean by that term. So Felicity, can I come to you to start with, please?
Yeah, so where I've been working in AHP Preceptorship now for 2 years, I've kind of grasped my sort of own idea of what preceptorship is, and how it's, really relating to those that are, in their first year of practice or first 2 years of practice. So what I found that to me, it's actually consolidating that learning that you've taken from university and applying it into real life practice, as an accountable clinician. Because we're taught lots of theory and we go on placements, but as a student you can be quite protected. So when you go into your first role, some people go into their first role and they might not have even had a placement in that area. So it's actually really applying that as a real life practitioner, as an accountable clinician. And I kind of say it is, it's like when you go to learn how to drive. You learn how to drive safely, but actually when you're in the real life and you pass your test and you're driving by yourself, that's how you really learn how to drive. And that's what I tend to say to our preceptees, you've been taught at university how to do your role safely, but actually applying it and becoming your own practitioner, that's what you learn when you're out there doing it by yourself. And preceptorship just offers that structure and that supportive environment to be able to adapt to that real life practice, and just means that they're still getting that support that they're used to as a student, but a little bit sort of differently, obviously, in real life practice. And I found that it really helps with creating a sense of belonging within their profession and their organisation. It also really helps with their resilience, especially those that are coming out now and they may not have had those clinical placements during COVID. And I also find that it really helps with solidifying that professional identity, especially for those that are going into big MDT teams, where boundaries could be blurred, and it really helps solidify what their actual role is within the team.
Thank you, Felicity. The driving example I really like that. That really resonates with me. It's a great example. Amanda, what does preceptorship mean to you?
To me, it's about supporting people to feel confident in their role. So you're taught clinical skills, but it's the other skills that you need. So it's developing, as Felicity mentioned, about resilience, but it's also feeling confident within the team working, feeling like you're valued, like you belong, that you have your part to play. So there's definitely something there about who are you as Amanda, the physiotherapist, but who am I as an AHP? Who am I as a healthcare worker? Where do I fit in with everything that's going on around me? And if you feel confident, then you provide better care for patients. So it's about giving people that confidence in their own skills, their confidence in their own development, so that they can be the best they can be and they can provide the best care for our patients at the end of the day, but also develop for the future, because learning doesn't stop when you finish university or when you come from overseas or return to practice. It's about keeping that learning going, knowing what your own needs are, but within the healthcare system or environment that you're in as well. So yeah.
Thank you, Amanda. Chantal, from a speech and language therapy perspective, being quite new into your role, what does preceptorship mean to you?
So for me, it was quite good because it was structured in terms of having a timetable. So at first I was oriented into like the hospital environment, and that was so important for me because most of my placements were actually in community at the time. So for me, I felt that it really helped to develop my professionalism and my confidence in making clinical decisions, and also giving me the best chance at achieving my newly qualified practitioner competencies. I also felt that because obviously like work placements can be quite varied in terms of when you were a student, in terms of what's on offer. So I was transparent with my preceptor in terms of areas that I felt were my strengths, and then areas that required more support and more help. And actually at my trust, because they have something called a video fluoroscopy, so I didn't get a chance to see that on placement. And then by that, it's an X-ray of a patient's swallowing function. So I was just like, you know, amazed by all this different technology and actually having the chance to see that in practice. And for me, that really strengthened that link between theory and practice, and obviously different instrumental assessments that are used to diagnose patients as well.
Thank you, Chantal. Really interesting. And I think, as you mentioned earlier as well, that the fact that we've been through the pandemic makes this even more relevant, what we're talking about, doesn't it? Because we know that people have had slightly altered experiences during their training and their learning. So really key. Thank you, Chantal. And from that perspective, from sort of within a university, what does preceptorship mean to you?
I think it isn't just, if I can sort of define it in the sense that it's a transition period, and it's a structured transition period. But I think preceptorship, whilst we're focusing a lot on students who then graduate, who then become our newly qualified colleagues, preceptorship actually goes across lots of different boundaries as well, because we all transition into the next level of role. You know, you might be 20 years qualified, but you're still transitioning. So just to sort of preempt what I'm going to say, really, but I think it's a brilliant opportunity, and I agree with everything that Felicity, Amanda and Chantal have already said, but it's a brilliant opportunity for an individual to get confident, to almost identify what their particular needs are, because as Chantal said, it's very varied as a student. It has to be, you know, it's luck to some extent where you get your placements. So a bit like the driving analogy, which I too love, Felicity, it's a bit like, you know, you might pass your test, but you've still never been on the motorway, you know, and as such, we all know we do a lot of motorway driving. So there is that sort of period of time that is dedicated to you as a newly qualified member of the team to identify what your unique situation is, but also to get really embedded and understand the culture of where you're working, understand the priorities, the aims and objectives of that particular institution, whatever it is, whatever organization it is. And I think it's not just about confidence, but it's also about empowering that person to really be able to be confident, saying, actually, I do know this, this, and this. It all fits together. That jigsaw makes a lot more sense to me now. I can see the big picture. And that enables somebody to do their job so much more efficiently. And that's a good feeling, isn't it? We all like to feel that we know what we're doing. We've got our feet on the floor firmly, and that we can see the path forward. So it's often a year, it's a 2-year process, depending on different places. And one of the things that we learned in doing a survey of our AHP colleagues in Staffordshire, Stoke-on-Trent, was that actually one size doesn't fit all. And as such, different professions have almost got a different culture within our AHP professions of what is normal for them, it would appear. But actually, one of the unifying things was flexibility, was what people really wanted. They wanted to have some individualization of their preceptorship journey. And they definitely wanted, if at all possible, a named person to go on the journey with them, and to be that preceptor person, to say, actually, can I go to you and can I have regular meetings in order to actually become my best self?
Thank you, Anne. And I agree completely. And I think one part of the national work that we're doing at the moment is really starting to try and understand how we make sure that preceptorship is tailored to that individual's professional background. So that might be slightly different for a speech and language therapist like Chantal to what it might be for a physio like myself, or to a podiatrist or a prosthetist and orthotist, etc. So I think that is a real key part of that. And remembering there's an individual here as well, isn't it? So everyone's individual needs will be slightly different. Another thing I often remind myself of when we talk about preceptorship like this is that this isn't something new. You know, this is something that we've always done for those that are entering the workforce and making that transition. But I think this is just a way of trying to preceptorship is a way I see it as being able to almost formalize this, so that we're actually ensuring that everyone's got some consistent approach to it, and, you know, trying to push up the bar in terms of the level and excellence that we see in terms of delivery of preceptorship. So thank you all. That's really insightful to share your thoughts on preceptorship with us. Felicity, I'm just wonder if you could now just maybe share with us some of your thoughts in terms of what an actual sort of typical preceptorship program might entail and what would be delivered within a preceptorship program.
Yes, absolutely. Just to add on to that, just wanted to share a main theme that we tend to get for newly qualified, and something that preceptorship really aims to tackle is imposter syndrome. It's something that comes up with every single preceptee, and it just adds on to those points that we've been saying there, and you know, really helps with their confidence and their competence, and it helps with that imposter syndrome, because everybody comes in thinking, oh, I still feel like a student, I don't feel like I'm qualified to do this. So that's exactly what preceptorship aims to do. So in terms of what a programme would typically include, so obviously each trust has their own way of doing preceptorship. You know, we have multi-professional, where some trusts link in with their nurses, especially within acute. Then we've got sort of hybrid approaches, which we've worked with as well. So they have an AHP spin on preceptorship as well as linking in with nurses. And then there's also AHP specific programs, which is a program that we run, which is sort of separate from the nurses. So typically a program would include like a band 5 support group. So within that, the trust will cover topics that they feel is relevant to their maybe organisation, or the main themes that are coming out from their band 5s that they're employing. So for example, within our program, we have it's more the soft skills, because we know that individually within teams they're tackling the more sort of clinical skills. So we do things that are like the resilience. We look at professional identity, so we actually address those topics. We also look at things that maybe the preceptees want from us. We really want to gauge their feedback and tailor our program. So again, adding on to Anne's point there, we like to be really flexible, and we like to, you know, change to, you know, what's going on in the world as well. So we like to address common themes that are going on in the NHS as well. So yeah, typically a band 5 support group, and then most AHP preceptorship programs have like a portfolio of some sort, and within the portfolio tends to be competencies. And again, that's what's going to really help with their confidence and really tackle that imposter syndrome, because they know that they're hitting their competencies and they're having the opportunity to reflect on their practice and also share that reflection with their preceptor and also with the other newly qualified professionals. Within our portfolio, we link it to the HCPC standards of CPD. So again, they're really understanding what the HCPC is all about, because we all know it can feel very overwhelming, the thought of being audited, but actually if you start that from when newly qualified, it won't be such a daunting process. So a portfolio of some sort, and then also looking at the supporting those that are supporting the preceptee. So we want to look at supporting our preceptors, and for us we provide training for them and also support groups for the preceptors. So we want to look after everybody that's involved in those that are looking after the newly qualified. So that tends to be what's included within like a preceptorship program.
Thank you, Felicity. That's really insightful. Anne, did you want to come in?
Thanks, Helen. It was just to pick up on a previous part of the conversation about where students view preceptorship, and I was just going to say that actually preceptorship is a really attractive proposition to a student who is about to qualify, because they then know that employer really values their staff, and so we always say to students, well, actually do have a look, ask when you're even looking round or at interview, ask what the preceptorship program is, because that tells you a lot about that particular organisation. So I think that's really important, and I love this idea of a support group, because for many of us, I mean, I too remember, it's a long time ago, but I do remember feeling a bit petrified starting to qualify, and you just think, oh my goodness. But that is brilliant to have a support network around you. And for the preceptors, I think that's brilliant, those who are equally wanting to do their best job for those new staff, but actually they need the guidance too. So that's all really what I wanted to add in there. Thanks, Helen.
Amanda, would you like to come in?
Yeah, I was just going to pick up from something that Felicity said, which is about the sort of the different layers of preceptorship that you can have, because I've worked in organisations where you might have that multi-professional layer where you're working within the MDT, so you're working with your nursing colleagues, your other AHP colleagues. You get a much better feel of where you're placed within that MDT and how you can work together. And things Felicity mentioned about resilience, but we were also doing things like human factors, communication training, things where it benefits the MDT and then benefits patient care. But then alongside that, there was sort of your profession specific skills that might come in, and they might be delivered by your department or by a directorate. And then some e-learning. There was e-learning that went through either from the department themselves or the trust. And we've got e-learning that will be coming up in the future as part of our programme to support. And then there was the peer support, but then there was a system offering as well. And there was you know, working with AHPs within your own system, doing some preceptorship work as well. So it really feels like this is really exciting work to be doing, because it's a field that's expanding and exploring new possibilities. But as the panel have already said, it's not one size fits all. So what might work down in Dorset might not work up in Staffordshire, might not work in London. And it's tailoring it to, again, the individual, the profession, but also the area and location that person's in. And then just picking up what Anne said, it's so vital in recruitment and also retention of staff. So people will be attracted to your organisation because you're offering them that support, but that's how come you keep them as well. Because you offer them that support early on in their career, they will feel valued, feel part of that team. They'll want to stay and develop within your organisation. So it's definitely got benefits for individuals, but organisations as well.
Thank you, Amanda. And I think we know that we've got some significant shortages in the workforce, you know, across all health and social care, I think. But, you know, those are very evident also within the allied health professions. So really important that we retain people when they do join the workforce, as you just talked about, Amanda. Chantal, please join in.
Hiya. So I liked how all of you guys mentioned working with other members of the allied health professional team as well. And I felt like, especially on the stroke ward as well, I feel like that's so important. Well, it's important everywhere. But yeah, so when I first started out as an NQP, I did request like extra learning opportunities. So I asked to shadow other physios carrying out chest physio and patients with swallowing difficulties. And then also joining other occupational therapists and watching them carry out daily activity tasks and kitchen assessments with patients with communication difficulties. So I feel like as an NQP, that was really invaluable for me, and seeing like how our different professions link together and how to maximise patients' outcomes whilst also improving my understanding of other people's roles in the MDT.
Thank you, Chantal. And as a NQP or a newly qualified practitioner, I think it's great that you had that confidence to speak up and to be able to ask for that support. And again, I see preceptorship being a way of almost just formalising some of that for those who maybe don't feel as confident to speak up and ask. So thank you. I'm just conscious that we're talking quite a lot around those that are sort of newly registered, newly qualified, moving into the workforce. But I'm also conscious that preceptorship is about supporting those that might have left the professions for a period of time, maybe to have a family or to explore other careers, and are actually returned to being an allied health professional, or even those that may have been recruited internationally and educated internationally. So Felicity, I was just wondering, do any of the programs that you provide differ in any way for those that aren't specifically newly registered to the Health and Care Professions Council?
Yeah, so we've kind of got two programs that we run to ensure that after newly qualified preceptorship that there's they don't fall off the support wagon, and actually there's something else in place for them, and that's what we call beyond preceptorship. So we tend to look at the circumstance of the international recruit, or whether it is return to practice, you know, what banding were they at previously in terms of return to practice, you know, how long had they been in practice before. Do they feel that they'd want to go into the newly qualified preceptorship programme because they want a bit more structure, a bit more support, linked back in with the HCPC, or do they feel they just want to have like extended support with beyond preceptorship to take a deeper dive into those things such as like leadership and supervision, because they've had that grounding experience before. In terms of international recruits, that's exactly the same for them. We kind of assess their situation and what support they feel that they need. And what we do with international recruits is, because it's such a big transition for them, not only you know, are they getting used to their new role, they're getting used to a completely new organisation, a completely new country, and how policies and procedures are, that, you know, it's a completely new world for them. So we try to incorporate their, because a lot of trusts have like probation periods, we try to incorporate that within their preceptorship and really have that reflected in their preceptorship, because that's a huge thing, just to even be able to transition into, you know, working in the NHS. So that's what we try to, that's a way that we can make it very individualized to them, and really recognize that they are going through a different transition to those that may have, you know, studied in this country, and, you know, tailor their support.
Thank you, Felicity. That's really helpful. It's obvious that you're all very passionate in terms of preceptorship. But Amanda, what actually inspired you to be in sort of a national role where you're leading national work around preceptorship for the allied health professions?
So for me, I think it's about thinking back to when I started as a junior physiotherapist, and I was lucky enough to join as a cohort. So there was a group of about 8 of us at the same time. We had that peer support, but there was this expectation that you were suddenly this qualified physiotherapist, and you put an expectation on yourself that you should know exactly what you're doing, and that you're taking on this workload and this caseload, and that you should know exactly what you're doing, and you don't. And unfortunately, you don't know sometimes what you don't know, and it is about that wider working. And so for me, that was quite evident. I was lucky enough to have that support from my peers. As I then progressed and became a team leader, I could see that that wasn't the case for everybody. Not everyone was getting that. You might have some professions where there's only one newly qualified member of staff that's coming into an organisation, and they don't get that same support and that same feeling. To me, it was about making sure we do support people, that they feel confident that they want to stay. And then I stepped into that arena of preceptorship in my organisation, looked at it for physios. It sort of enveloped into OTs and speech and language and dietetics, and then further to AHPs. And I realised that not everyone had access to a preceptorship programme or even preceptorship support. And further conversation showed me that actually the landscape is very varied across the country. And a lot of this is about, can we share good practice? Can we pick up where there's models of good working, models of good support, and share it with others? Because there's a lot of people out there who are still thinking, where do I start with this? How do I get our diagnostic radiographers involved with a program in a trust when they haven't been involved before? So for me, stepping into the sort of the national arena with this, it's about hearing what's going on, working out where the gaps are, thinking of what else we can do and how we share that practice, and how we can empower not just our staff, but empower our organisations and our systems to work differently to support people to go forward, so that we've got the right workforce for the future, because that workforce is quite different than if we'd looked a few years ago. So for me, what inspires me every day is hearing what else is going on and hearing what people are doing, and working with people like we've got on the panel today who are so passionate about this area that actually it feels like we've got this momentum and we can really support people going forward. So, yeah.
Thank you, Amanda. That's really great. Anne, did you want to come in?
I just was picking up a bit about what Felicity was saying about our international colleagues, mindful from the university end that when we have either students who want to transition into our programmes, our pre-reg programmes, or indeed colleagues who have worked overseas and want to join us on the staff, one of the things that has become increasingly obvious is that we assume, don't we, that everyone's like our family, but actually it isn't like that, and the actual training is different in different countries, and there's a different emphasis depending on what profession you're in. So I think preceptorship becomes even more vital for those colleagues, and that individualisation is going to be so important too. And we know from some of the focus groups that we have followed up with, and some of our preceptees who were in Staffordshire, Stoke-on-Trent, said for them it really made all the difference having that support network and having some preceptorship formalised. And for some of them during COVID, I mean, Chantal's was in the middle of all this, but some of our newly qualified colleagues in Staffordshire, Stoke-on-Trent were saying, I nearly left because I just found it so challenging and it was beyond my experience. But the preceptorship collegiate approach made all the difference. And it was occupational therapists supporting speech and language therapists and vice versa. And we all know that often we're at our best when we're working in a team. Not clearly, some AHPs are a little bit more on their own than others by the nature of their work, but it just struck me. It was a really powerful statement that we were hearing from our junior colleagues who were saying this made all the difference to me. So yeah, just wanted to add that in, really.
Absolutely. And when we get that right, that true multi-professional perspective right, it's so powerful, isn't it? It really is. Felicity, what are some of the what's some of the benefits and how does it help in terms of preceptorship and receiving preceptorship?
So in terms of the benefits, you know, we've seen loads of sort of different benefits, but in terms of the preceptees, obviously it's tackling that imposter syndrome. They've got a dedicated person within their organisation they know that they can go to in terms of a preceptorship leads. They know from the get-go that they've got not only their team but also like an organisation that are supporting preceptorship. It also is tackling that professional identity. That's what we hear quite a lot with our preceptees, especially those that may be in acute or working within MDT, like mental health setting. So they really struggle with setting those boundaries. And you know, when you're newly qualified, it's hard to say no, really hard to say no. And actually knowing what those boundaries are, and it basically just really reinforces what their role is, as well as improving their confidence, like Amanda was saying about. Then that goes on to improve patient care. It helps with that overall job satisfaction. And what sort of Anne was just saying there about having this support network. So it's probably our most bit of feedback that we get about our program is having a community that they can share their experiences with. And I can relate because I'm a podiatrist. We're a very small profession and we work very isolated. You know, we can work across a huge borough and I could go a week without seeing another colleague because we've got to spread out across the borough and there's not many of us. So when I first started, there were times where I felt very isolated. I was relatively lucky because I started with another band 5, but I see the ones coming in now and they'll be the only band 5, and that you can feel very alone with those feelings of, oh my gosh, I feel like I've got imposter syndrome. I don't know what I'm doing. I feel like I'm the only one that feels this way, because you're in a team that's very, they've been in a team for a while. They all know what they're doing. And you feel like, oh, if I ask this question, do they feel like I'm a burden? So we address all of those issues within our meetings, and nobody feels alone in their thoughts. And that can make a huge difference. And, with their mental health and their well-being at work. So I think one of the huge and the most important benefits is having a community that are all going through exactly the same thing. Definitely what we've seen. And in terms of what were also the benefits that we've seen within service users. So if you are feeling more confident in your practice, obviously that's going to go on to help with patient care. And we've had some really lovely instances where because of one of our competencies, they've gone away and looked at evidence-based practice and they've changed or implemented something new within their team. So again, it's empowering them to come with a fresh pair of eyes and actually can they suggest something different within the team, because when you're newly qualified, again, that can feel very daunting and very overwhelming, and to suggest something you're like, oh, I don't know if this is the right thing to say. So that can in turn help with service users and help with the team management side of things as well. And then the organisation approach, we've seen benefits with recruitment. People are applying to Oxys because they know that we've got a really robust preceptorship program in place, and we have dedicated leads. So we have someone that lives and breathes it every single day, and preceptors, preceptee know who they need to turn to get support with preceptorship.
Thank you, Felicity. And so powerful to hear that example of how it actually goes around and truly impacts in terms of patient care and the quality of care that patients deliver, which is ultimately what we're all here for as well. Amanda, would you like to come in?
I was just going to come in with the point about career progression. If you're supporting someone and you're making them feel more confident, that has a knock on to their competence, because actually they feel like they can bring their best with their capabilities and their skills that they're bringing forward. So what I've also seen, and I hear about when I talk to people in different faculties and different regions, is that people are feeling empowered, that they can then go for career progression. They can look at those other roles that they might have thought they might not be able to go for yet, because they actually do feel confident that they've got those skills and those other skills that they need to progress themselves. And also, I'm inspired by what Chantal's been saying, because if you have a really good preceptorship experience, you want to be a preceptor because you want to give something back. So it actually breeds that improvement in preceptorship, because actually if you have a good experience, you will then go on and support others. So that's something that's really important to me as well, is what do those preceptors need to give that confidence for the future and keep that going.
Great, thank you, Amanda. And obviously the preceptors play a really vital role in this, but it might be worth us perhaps exploring if there's any benefits for them preceptors themselves as well, who are actually delivering these programs. Anne, did you want to come in?
I did. It was just to build on another theme that we've just briefly touched on, but about leadership, because I think many of our newly qualified colleagues are very quickly on in their career actually put into leadership positions, and some of them are running clinics independently within weeks of actually being qualified. And there's so many different layers to leadership, and I'm sure, you know, all of us have been trying to become better leaders for many years, but actually it's a really supportive environment to have a preceptorship program which actually includes leadership and actually builds all of us. Now, hopefully many and most pre-reg programs for AHP programs should include elements of leadership throughout their program, but that said, I think to include it within preceptorship is really good. And in a way, it's a bit of a test as well when you go and if you're interviewed at an organisation and you ask them a little bit about what their perception of preceptorship is and the value of it, you get a really good gauge of what the managers think about it and whether they value it. So it's actually all linked together, I guess, in terms of the big picture. So I think leadership was just something I wanted to say, but perhaps slightly differently about clinical supervision is in addition to preceptorship. It should never be a replacement. And I don't know what Chantal's experience is, and she's probably better to talk to this, but I think that's something we tell our students. You know, when you qualify, you'll have your caseload, but you'll have the opportunity, or you should have the opportunity, to always talk through any challenging cases with a senior, and that's clinical supervision. It's not preceptorship, which should be something in addition to support your learning. But you know, Chantal is far better to speak to that than me.
Thank you, Anne. That's really insightful. Chantal, is there anything you want to come in with in terms of sort of sharing your experiences about, you know, first-hand experience about what the benefits and the impact's been for you?
Sorry about that. So like I mentioned before, it really helped to strengthen and improve my confidence making clinical decisions. And I just really loved how Felicity touched on that imposter syndrome, because I felt like that, and speaking to other NQPs newly qualified practitioners from different backgrounds, we all felt like that, and especially during the pandemic when so much was going on. But the trust that I work for currently, they really helped to support my development. So for me, I got experience working in different types of wards and with different types of patients. So I had two preceptors. So I had one preceptor in the stroke ward. So that was focusing on, you know, when patients have had a stroke and how communication and swallowing can deteriorate because of that. But then I also got to work on more like general medicine wards as well. So some of the elderly wards where there are a lot of patients with dementia, or some of the patients with Parkinson's. So it was actually good for me to have two preceptors, because then I got to experience different working styles as well, and also just building on their varied experience and all the things that they passed on to me. I also felt that essentially just helped to lay down that foundation for my skill set for the rest of my career. So things such as developing my communication, and sometimes things that we forget about is it's not just about communicating with a patient, it's also their family as well, and adapting your communication and working with the multidisciplinary team. So for me, sometimes, well, initially when I started off, I would do sessions with my preceptors, so I would observe their sessions. Then it kind of transitioned into me carrying out sessions that they would observe me doing, and then me doing independent practice, and then feeding back to them and reflecting on things. So again, that helped to link theory to practice. And yeah, I just found it really, really interesting. It was brilliant. And I feel like another positive of preceptorship is that it strengthens and helps to build a rapport with your preceptor and other clinicians that you've shadowed as well. And for me, that was so important because it meant that I could be transparent and talk about areas that I needed more support, and I didn't feel judged at all, and getting the support that I needed. And then it actually helped me to develop my skills further and achieve my competencies. And because of that, I feel like it helps the trust as a whole to retain staff. So I was able to develop my skills, and then I got promoted this year as well. So yeah, it's been good. I think it's invaluable, and it's just supporting junior staff, and then it's like a knock-on effect for us to support other new staff that come in.
Excellent. Thank you, Chantal, and congratulations in terms of your development as well. I think it's I really like the idea of you having two mentors as well, and getting the benefit from two slightly different angles. Has it inspired you to be a preceptor in the future, Chantal? And is there any learning that you'll take with you into that sort of preceptor role potentially in the future?
Yes, I think it's good to be very transparent about, well, being direct about your aims in terms of what you want your preceptee to learn, and establishing their goals within like individual goals, but also like the local goals of the trust as well. And I think it's good to inspire other people to be able to speak up about their strengths and areas to develop as well.
Thank you, Chantal. I think you're absolutely right. It's about some of the work we're doing nationally is about developing some principles, some evidence-based what works in terms of preceptorship for allied health professions. But remembering, therefore, just what you made that point really well about is then tailoring that to that individual and that circumstances within that organisation, within your profession, etc. So really key. Amanda, would you like to come in?
Yeah, I was just going to say, following on from what you just said, Helen, I think that's why we're seeing a lot of preceptorship programs now, including return to practice and overseas educated, but also change of sector and change of role, because there is that understanding that if you can support people through that transition, support them with their confidence, then actually you will get a more confident and competent individual at the end of it, which will support your workforce. And I think what we're seeing is that tailored support in that way, because they might not need everything that might be supplied for a newly qualified member of staff, but you can pick and choose. So it's a little bit like a sweetie box or something, that you might pick one thing and pick another thing, but actually you don't need some of the other aspects. So it's about that tailored support. But we're definitely seeing people considering return to practice and overseas educated definitely as part of preceptorship programs, either alongside, as Felicity was saying, or actually embedded within what's already existing.
Thank you, Amanda. Anne?
You've made me think of something there, Amanda, because again, some of the feedback we got from our survey, but also our focus groups, was there's real value in coming together all as AHPs together, maybe to have some face-to-face, but actually there's also real value in doing some sort of discipline specific training together and really trying to upskill together, as well as that sort of mixing some of it as well. Being online is great because it can be, you can dip in and out. Actually, Tuesday's a better day for me, and so I'll catch up on that at 3 in the afternoon or whatever it is. That flexibility, so a blended approach seems to work so well, and that's something that we've, I guess, become much more skilled at delivering over the last couple of years. One of the possible benefits of COVID, but that that's that flexibility again. It's about individualizing it, isn't it, for whoever the individual is, and what do they need, and what does the organization need from that new employee as well. Because actually there's certain things that, well, that could wait till, you know, you've been with us a while, whereas certain things to enable you to do your job well, you might really need to understand in the first few weeks, and preceptorship allows that to happen.
Absolutely, thank you, Anne. I'm just conscious of time now, so I'm going to draw us to a close. It's been a fascinating conversation. I hope it's been really insightful for those that have been listening in. I'm hoping that it's also been really reassuring in terms of those that might be thinking about a career in terms of any of the allied health professions, the support that is actually available, and we're continuing to develop, because although this is work that's happening nationally, this is already happening out there and support that people are already receiving, as we've heard from Chantal. But what we aim to do over the next sort of few months and is to try and increase the consistency of that offer and continue to drive up the quality of that offer for all allied health professions. So a very exciting time to be potentially joining the workforce in the future, or even returning to the workforce as well. Thank you all very much, and I'm sure that people have benefited lots from it. Thank you.